Hey everybody, Dr. Ericka with Premier Chiropractic. So today I wanted to just share some helpful information with you in regards to what do I do, or is there something wrong if I feel pain after an adjustment? So first off, let me just pretext this with our culture and our society has taught us that pain is bad. We don't want to have pain. It's really easy to just take an ibuprofen when I have pain. But I have to remind you that, remember, pain is a response from your nervous system telling you that there is something wrong, okay? So if we get a pain response bringing us into chiropractic care, of course that's good because we're trying to address the why. Remember, we always want to talk about the why behind what our body is doing. But what happens if you have pain right after you get adjusted and you feel like the adjustment initiated that pain or made your pain worse? So first off, I need to tell you why that can happen. So when we are talking about your spine, and remember, we're looking for subluxations in the spine, subluxation when the vertebrae is out of alignment. Keep in mind, guys, that subluxation is creating inflammation within that joint capsule. Remember, that's what's going to irritate and inflame the nerve, giving you a pain response in the first place. That nerve also could go into your lungs and create your lungs having an issue. It could go into your digestive organs and your digestive organs have an issue. But again, we're going back to this whole pain concept. So I have a subluxation. You get a specific adjustment. We realign that segment, and then maybe you again feel an increase in pain right after. So what is your body doing? Well, when we realign that vertebrae, we're helping to, again, realign that joint capsule. And remember, that pocket of inflammation in there, when that leaves your body, it can actually have a response on the muscles and ligaments near the spinal vertebrae that we just realigned. So therefore, the muscle could potentially spasm a little bit. The ligament could get tender and taut a little bit because of that inflammatory pocket that came out of the subluxation. So this is why in our office, we always like to say less is more. We only do specific adjustments because we want to realign what vertebrae need to be realigned and minimize the pain response. But what happens if, again, that happens? Well, first off, you need to drink a lot of water. Remember, your body is releasing a lot of inflammation. This is just like braces on fresh teeth. You're going to be really sore the next day. And so again, that can happen. We try to minimize it. At the same point, if that lingers for longer than 24 hours, then you need to come back in and let us check you again, because your body is fighting that alignment. The muscles, again, potentially spasming. The ligaments are tender and they're taut. And if we realign that segment again, chances are in 9 times out of 10, that pain response is going to almost instantly go away, because we can now efficiently and specifically remove that pocket of inflammation that your body's reacting to. So again, pain after an adjustment in majority of cases is going to be an inflammatory response from the subluxation, removing the inflammation. If it does not go away within the next day, then let us recheck it. Chances are we need to realign that segment again to get that junk and get that tension out of your body. Drink lots of water, stay hydrated, and stay on focus point with your care.